All right, so let's dive into this topic of the 4Ms. And to do that, I am going to share my screen. Let's see. All right, so you should be seeing a screen, and I'm going to include a link to this website so you can see where I'm beginning. But basically, it's called My Health Checklist. It was created by IHI, which is the Institute for Healthcare Improvement. You kind of see that right here in the top corner, their logo right there, and you'll see 3 lists: English, Portuguese, and Spanish. So I'm going to select download in English, and there it is. From here, I can save it. I can save it and print it if I want to. I actually do have a printed copy. It is 12 pages, but it's big print, tends to be big print. So I encourage you to go ahead and do that. So watch this video, see if this is something that you are interested in. I hope you are, and then you can take action on it. So it's 12 pages. I'm not going to go through, I don't think we're going to have time to go through everything, but I want to explain at least some of the major concepts. So this is something for you. If you have a spouse or you have a friend that's interested, they would have their own copy. And you can work on this by yourself. You can work on it with someone. They can help you. You can discuss these things, whatever your preference is. So here I'm going to navigate over to here. All right, so before we get into like what is this checklist, let's talk about something very important. That's the basics of the 4Ms. These are the 4Ms. What matters to you in your life, medication that you may take, mentation, and then your mobility. We call these the 4Ms. And this is really a framework. All of our health, whether we're an older adult or not, they could fall into these categories. And this was designed for, in the first place, for providers to, when they are doing an assessment, when they're having a visit, an appointment with a patient, to make sure that they go through these 4 categories, because it's going to impact adherence to medication. It's going to adhere to decisions, even surgery, even decisions of, do we do this procedure? Do we do this surgery? So these things all this information that's gathered from both the medical record and from the patient that's in front of them helps to inform some shared decision between the physician, the patient, and sometimes with the family. So I'll go through these each very quickly as we go through this guide. So the 4Ms you can consider it as a framework. Now, getting back to this guide, some good advice here. You can complete this guide in any order that you want to. You can take it in small pieces, so it's okay to skip a question, take a break, come back later, which I would recommend, because it's a lot. There's a lot in here, and I say that in a good way. It's a lot of good data, a lot of good information that you'll be going through yourself and potentially sharing with others. You can talk about your answers with someone that you trust. These pages are here for you to help gather your thoughts. Later, you can decide what you're going to share with your provider. But typically, the more that you share with them, the more they can help you and guide you in your discussions and decisions. You can print this in a larger font. You'll just go to this website and you'll see instructions and more resources on how to do that in a larger font. But it is pretty. It's a pretty good size. It's probably 14 to 16 size font. That's easy to read. If you are helping someone to fill this out, you might start with thinking about this, talk about why this will help them. And you might say, I want to make sure that we talk about what's most important to you, so we can have a more useful conversation with your provider. And this focuses on what matters to you as we support you. And it's really about care needs, and goals. All right, so the first one is what matters. And that typically is the first one, because it's important to know this is going to guide everything else. This is going to guide healthcare decisions followed by the other ones. So we don't look just like it at this one, but this one's important. It's a good, sets a good foundation. I'll put it that way. All right, so think about what is most important to you and what you enjoy the most. And this can help you think about what's most important to your health. So we start off with what is your situation now? What are the most important things to you in your life right now? Have there been any health or life changes since the last appointment? And then what I like about this, for every question of each of the M's, each of the four M's, they have some ideas. And this will give you some ideas to kind of get you thinking about what your answer might be. Your answer might be contained in some answer in the some ideas example, or it might be something different, but it's to kind of get you thinking. All right, so what's going well? What could be going better is going to be on the next page, on page 5. So what activities do you like to do? Here we have watching sports, playing music, being involved in the community, could be involved in a church group, a civic organization, visiting grandchildren. You might be somebody that volunteers and you go visit the sick. Either they're in homes or they are in hospitals or nursing homes. That might be important to you. So whatever it is, whatever what gets you up in the morning, what do you look forward to? That's going to be what goes into this box. And then the next question is, what could be better? Is anything getting in the way of those things that you just listed as enjoying, the activities that you enjoy? For example, do you have trouble sleeping? So that means when you wake up to go do that activity, wake up in the morning, you're looking forward to it, but you may not have had enough rest to fully enjoy it. So that's an example of getting in the way. Let's see another example, harder to get around. So that one, and we'll talk about that with mobility as one of the 4 M's. It's hard for you to get healthy food. Either you live far away from a grocery store, so it's hard to get healthy food, or you're just it might be managing your budget. That might be a challenge. But these are all things that help the provider help you to determine what matters and how to get that and how to make sure you're able to do that. And what do you want your provider to know about you? So if you're responsible for someone else, you might be a caregiver for someone. You might have particular goals this year. Perhaps you want to go on a trip, and you, of course, need to make sure that you're healthy for that trip. Is there who or what makes me feel worse? Is there someone in your life that makes you feel worse? That it might be abuse or close to abuse, but it's somebody negative. These are important things. It gives the physician or the nurse practitioner an idea of what may be going on in your life, especially if it's a challenge. So we've talked about at this point covering this 4M of what matters most. The physician and even you yourself have time to reflect on what are the things that you look forward to doing, what give you enjoyment, what are things that might prevent you from doing those activities, and what else is going on in your life. What are goals? What are some other situations, family relationships, etc. So that sets a really good stage in your mind, but also in the provider's mind of what life is like. And then we get into medications. If needed, medications can be an important part of your health. It's important to make sure that it's working well, so that the medications that you're taking are working well with the other ones. So let's get into these questions very briefly. What is your situation now? What do you take on a regular basis, regularly? Which ones do you take only when needed? And it's important any time that we're talking about medications, you're also including over-the-counter things, herbal remedies, supplements, vitamins, etc. And ideally, you know what those are, and you even bring them in a bag. You get your brown bag or your Walmart bag, and you bring all of these to your doctor's appointment. But you certainly want to list them too. Are the medications helping you reach your goals? And that's something really important, because there's this idea of de-prescribing, on medications that are not doing anything for you, that you feel are not working, that might be expensive and not working for you, what have you. And as an important note, you never want to stop medications that have been prescribed to you all of a sudden. You want to make sure you do that in consultation with your doctor, your nurse practitioner, your pharmacist, because it's been prescribed for a reason. And if you feel like you don't need it anymore, you want to make sure that you have that conversation with them, because they may be working, and you're just not realizing it, and there could be some negative effects. Also, as you know, there are certain medications that you have to taper off of and not just stop taking suddenly. All right, so what could be better? Are your medications causing any problems? So, of course, medications can have side effects. They might make you go to the restroom more frequently. They might make you tired. You might have some other side effect. They might make you feel nauseous. So these are things that you want to talk with them about. And then any other questions or concerns that you have. All right, then we're getting into the mind. I think I said mentation earlier, so you can say mentation or mind. And this is all about your mood. It's about your mental ability, including your memory and cognition, your thinking. So this is neat because it gives you these different questions right here, and you answer on a scale, this 5-point scale from not worried to worried, or mostly unhappy to mostly happy. So this is going to be good information. This is something that your physician should be asking you as well, is sort of like screening for your mood, like potentially depression. So most older adults will get this and should get this. Actually, all adults should get this. Is there anything that you wanted to add to any of the answers? Do you notice any changes in your mood or memory? What's going well? What could go better? And you can see I'm kind of picking up the pace because I want to make sure we get to cover the whole document, all the M's. And I know that you're going to want to go back and read these in detail anyway. So this is kind of like whetting the appetite, if you will. All right, so what could be better? Speaking of mood, your memory, do you have any concerns that you have for your provider? All right, so we've done what matters. We've done mind. I'm sorry, we've done what matters. We've done medication. We just finished mind, and we're on the fourth and final M, which is mobility. And we define this as how you are able to move and get around. This includes exercise, getting around the house, and even getting places outside of the house. So you'll probably see a pattern now. They're going to ask you this question: how is your situation today? How are you moving around the house? How are you getting from place to place if you're still leaving the house? And here are some examples. These are things of physical activity. I'm doing physical therapy. I tend to be on my feet a lot. I do use a cane or some other kind of assistive device. Getting around could include having friends and family take you, or taking public transportation, taking the coast shuttle. So that's what's the situation, what's going well, and then what is going better, or what could be better. Is anything limiting you? Trouble breathing when you've walked a certain distance, feeling unsteady. These are all super, super important things to talk about, to promote independence, to promote well-being, and just feeling good. So you can see why this could be a really helpful list for all of us. It's hard to carry my laundry to the machine. What questions or concerns that you have? So we've covered 4 questions, just like we have for the other M's. So once you've done that, here are your next steps. This is sort of like the wrap up in the final page of this, where it's like you take this, you've done all this thought, you've done this writing, you've done perhaps some discussion with family, and here you kind of put it together for the visit. So look back over your answers and write up to 3 of the most important questions or concerns for your provider, because as you know, the time that you have in the doctor's office is limited. So you want to make the best use of your time. We've had videos about this, about how to make the most out of your doctor's visit. And this is by far a very, very useful. This is the first time we're going over this tool, because it really just came out recently in 2024. So so that's why we're bringing this up. So the top 3 concerns, some ideas here. How can I reduce my knee pain? How can I get a test to check my memory? How does that work? You may want to talk about your answers with other people, a trusted person. Your answers also may change over time, because our health is going to change, right? Bring this and your guide to your appointment. And this may be something that you give them. It may be something that you're just reading off of and you have notes, or it's highlighted and like, I'm going to make sure I focus on these things. But this is something that is going to be very helpful in helping you getting your goals met. So I hope that you see it in that way, that this is a tool that's going to help. I would certainly say that it's not busy work. It's not a waste of time, even though it might take you some time. It's an investment of time. It's going to help you for specific reasons, to feel better, to stay independent as long as it makes sense. Or well, we always want to stay independent, right? And we're always interdependent at the same time. We're relying on people. Even when we're well, we all rely on each other for something. But as far as like your 4Ms, your mobility, your mood, we're checking all these things so they're up to they're as well as they possibly can be. All right, so that is the IHI My Health Checklist. I hope that you found this presentation helpful. I hope I hope that sharing of the screen was helpful. I hope that you will go to the description of this video, click on the link so you can explore this yourself. Go ahead and print it out. You might even be able to, yeah, you can type in this as well. So you can do that. You can save it on your computer. You can print it out. It can look pretty, or you can just do what I would probably do, is just print it out and just have, lots of information in there, lots of lining out things, or lots of rewording, so you kind of get it to where you want. Just know that this is your document.